I've been an e-marketeer for 18 years, 17 years of which I've worked in the pharmaceutical industry. And for most of this time, I've considered myself to be indestructible. That's me a few years ago, as you might gather, coming into the finish of a marathon. I played squash since I was 18. I've been running just about every conceivable distance since I was 18. Went through the marathons, progressed onto triathlons, play squash, tennis, and in my spare time I do extreme mountain biking. But as ePatient Dave has eloquently written, patient is not a third-person term. Our time, your time will come, yes. My time came in 1999. In 1999, I came out of a particularly awful meeting when I was working at Sharing, closed the door, and I had a stroke. I didn't know it was a stroke until I actually woke up in the hospital and the doctors had confirmed to me after the scan that I had a stroke. And I remember thinking, hey, I don't do strokes, I'm indestructible. But then it became worse because inevitably the doctors started to check and to see why I had a stroke. And they discovered that I had holes in my heart, so-called patent foramen ovale, which they believed were the cause of my stroke, clots moving from heart through these holes to my brain. And they recommended then I have heart operations. And I instantly started to think about MASH, chest cutter things. But what it ended up was that I had 2 cardiac catheterization operations, where so-called occluders. That's an occluder you can see there. It's a small device that actually blocks the hole. So I had 2 of these operations, and at that time it was very, very new. I was one of the first patients in Europe to have one of these operations. And then later on, they discovered I had a protein C blood value deficiency. This was responsible for maybe blood clotting, about 30% below what it should have been. And of course, inevitably, I had high blood pressure. So for the last 10 years or more, I've had to cope with all of these things. And at the same time, I was an e-marketeer working in the pharma industry. In fact, specifically at that time when I had the stroke, I was working on a second iteration of an MS community. I launched a site called the MS Gateway in '97, and I actually developed a community. I think it was the first community in the industry. And I realized at that time it needed to be upgraded. And so my experience as a patient helped me a great deal with developing the community. And at the same time, I was working on a concept for a women's health website called Female Life. You can see here there's a Norwegian version that it's still running. And I was trying to find a way in which to develop a workable concept. So in the course of this time, I've learned quite a few things, and I've gained many insights about being a patient. And I've tried to bring some of those insights to my work within the industry. And I just want to recap a couple of them. The first one is I don't think the industry really understands the patient journey. My journey has been from disease awareness, diagnosis, referral, treatment, compliance, and then understanding what it's like to be a long-term patient. I don't think the industry doesn't really understand this. I've been in many product manager meetings, launch team meetings, and inevitably the discussion always focuses around the doctor's needs, and it's very rare that you hear about the journey, the patient journey. And I believe a deeper understanding of the patient journey would help the industry in many ways. But a couple of things that helped me specifically. On the MS Gateway website, I developed the second iteration of the community and put in a patient, mentoring function. I became a mentor for other patients that wanted this same heart operation. And I realized just how important it was for me to explain to them why it was important in my experience. So I built this mentoring function into MS Gateway on the basis of my experience. I also developed the Female Life website based around the patient journey. In fact, what we did was develop a website that looked at the patient journey, women, not as patients as such, but the women's journey, looking at women's needs in fertility control from adolescence to middle age. And that turned out to be a very viable concept, and a concept we tested with patients and women, and they understood that and empathized with that. The other part of the journey that was very important for me is I've had these occluders in my heart for 10 years, and I've been onto the website of the manufacturer, St. Jude's Medical, to find out if they say anything about patients like myself, and they don't. They talk a lot about the operation and the device, but they say nothing about me and my stage of the journey, and I'm looking for a reassurance that after 10 years, I'll still be okay. Is that device still going to be viable after 10 years or hopefully 20 years? So it's another indicator that understanding the patient journey is very important. The other thing that I've discovered is the industry doesn't really understand the difference between rational and emotional needs. When I was told that I had a stroke, I was really very, very emotional. I didn't really understand what was going on, and I needed to be reassured. Before I could even think about rational needs, I needed to be emotionally reassured, and I think the industry needs to understand that. One of the things I did on the MS Gateway, I developed a compliance program, and I was very concerned about looking at emotional causes for non-compliance. And my experience was very important in understanding the emotional or so-called decisional balance reasons for patients not taking their MS treatments. And the final thing that I think I've learned is that the industry is not really compassionate enough. And I think by linkage, compassion and transparency are important. I think the industry has got to learn, certainly, that what it develops is for patients ultimately. And I don't see that sort of thinking reflected in the way it acts and the things that it does. And I think if it were to learn a little bit more compassion, and remember what is compassion? Compassion is about empathy, sensitivity, and understanding. And these are the things that I think the industry really needs. And I think if it were to develop more of that, the industry would be seen to be, and I think people would empathize much more with the industry. So at the end of this time, I've come to the conclusion that perhaps e-marketeers working in the industry may need to have an internship, as hard as that might be, an internship as an e-patient before they become better e-marketeers. So with that, we'll call it a day.